Pfizer is hiking prices for Paxlovid to $1,400 a dose. That is triple what it previously was. Recall that the U.S. government has been buying Paxlovid since earlier this year as part of its COVID treatment. And the U.S. government was only paying about $500 per dose. Now, a dose is a 5-day course of Paxlovid. So now Paxlovid is going to be charged at $1,400. So that's more than double, a little less than triple. Why are they doing this? Now, Paxlovid is the antiviral treatment that you give to someone who does have COVID. They say that the $1,400 price tag, it's only if you don't have insurance, because most of the time they're going to negotiate the price with your insurance company. It will be high if you're insured, but you don't have to worry about that. Also, anyone with Medicare and Medicaid can still get it, but people who are not insured and want to pay out of pocket, that's who's going to be paying this $1,400 price tag. Now, why this price hike? Is it just because now it's on the private market, or because Pfizer is having pitiful profits? Earlier this week, Pfizer announced that profits had plummeted, and the company will be forced to conduct layoffs in early 2024 and cut costs by at least $3 billion per year. Take a look at the company's profits. Now, we look at this over the last 5 years. You can see that they had a nice boost during the pandemic, mostly due to the COVID vaccine, and then a precipitous drop ever since. Now, you can see that before the pandemic, Pfizer was not doing all that well, and where we are now is at about pre-pandemic levels. Now, here is Pfizer CEO Albert Bourla responding to this revenue drop in a call earlier this week. He said, "We're in the middle of the COVID fatigue. No one wants to speak about COVID." I concur. He says, "We have this big anti-vaccination rhetoric." Now, we showed you this on Tuesday, how Pfizer had been hoping for 25% of the U.S. population to get this new untested COVID booster, because they figure 50% of the population goes and gets a flu shot. And if they can just capture 50% of that 50%, they've got 25% of the American population getting a COVID booster. But so far, they've only had 2% of the American population getting an updated COVID booster, and they have to share that with Moderna and Novavax that also have COVID boosters. But back to Paxlovid. The FDA approved Paxlovid in March of this year to treat high-risk adults only. How was that approval given? You probably can guess, but I'm going to show it to you. What does that say there? The thing that Clayton never can say properly out loud. Emergency use authorization.
Emergency use authorization.
Right.
So yeah, I got it.
Yeah, there it is. So they, rushed this through, this approval of Paxlovid.
But is there an emergency? I thought President Biden told us there's no emergency
Well,
anymore.
Take a look at the date on that, too. May 25th, 2023. At the time, we do have COVID rebounding slightly during flu season, but certainly in May of 2023, there was not an emergency. So how did they evaluate that this was necessary for emergency use and that Paxlovid was the right thing to give people as a COVID treatment? Well, they tested it on high-risk people who were unvaccinated 2 years ago and had not been previously exposed to COVID. That's not the population we have now. In fact, close to 90% of the population has either been vaccinated or exposed to COVID naturally, or both. And so what they did was tested on a population that we can't really emulate right now. Here is John Campbell over at his YouTube channel going over this data last year and showing, again, that it's hard to say from this data that Paxlovid is still the right thing for the population we have now.
Just before we go on, let's make it quite clear what I'm saying here is that the population now is more immune than the population this was tested on. So why isn't this trial repeated now? This is the key thing. If we repeated the trial now, we'd have the data. But is it logical to extrapolate, because we're supposed to be evidence-based, is it logical to extrapolate from one to the other, as the White House seems to be pushing? Pushing's maybe not the right word. That sounds a bit Steppenwolf-esque, doesn't it? Promoting. Promoting would be a better word. Promoting the clinicians to prescribe more Paxlovid. But is that based on evidence? Well, I'm not sure that it is, because it's based on previous populations. And of course, we don't have a previous population. We have we have a current population with much higher levels of immunity. So we really need data for this. Why isn't that trial being done?
Now, the National Health Service in the UK is saying there are no serious side effects of Paxlovid. That's not true. Paxlovid's own label sheet says that it can react badly with other medications. Recall that this is for high-risk people who are very likely to be on other medications. The clinical trials also showed that at least a few people had serious events and had to be removed from the trial because they had what they called either dose reduction or discontinued the drug because of an adverse event. So there were plenty of people who had serious side effects from Paxlovid. So to say there's no risk, that's a non-zero probability here. So maybe this is why the U.S. government is not only no longer paying for Paxlovid and they have to now sell it on the private market, but also they are requesting 8 million doses be sent back. They're literally returned to sender. Here is CNBC reporting on that.
The company is giving some of the Paxlovid supply back, or the U.S. government is giving it back to Pfizer. That'll be an estimated about 8 million doses of Paxlovid. But they're saying that now they're going to be able to commercialize Paxlovid for the private market going forward. So,
okay, does that mean that taxpayers get a refund?
Probably not.
No, don't even think it. Here is Pfizer's announcement of this. They're calling it a non-cash transaction of a return of 7.9 million doses. Instead of returning taxpayer money, they're going to provide it for free to people with Medicare or Medicaid or people with no insurance through 2024. They will also provide it to a government stockpile to ensure preparedness for future services. So this idea of returning it, but still having it in use in government-funded programs doesn't really make a lot of sense. I guess it's just a accounting entry, basically, because the U.S. government will have some in a stockpile and use it for government-funded medical care, but they're still returning it. I don't know. It just seems like you're taking it and driving it around the block. What, Phil?
Yeah. They're return it for store credit. You can return this for store credit, so now we can
Right.
we can purchase
Right.
something.
We won't give you cash back, but if you want to go buy some more medications here,
Yeah.
you can.
Well, for
do
us
that.
taxpayers,
Yeah,
it's a sunk cost. We did buy it, and we're not getting it back. And it was
Not a very
wealth
profitable
transfer
emergency.
to Pfizer.
Yeah.
Well, it was for
Right.
Pfizer.
Well, yeah, for Pfizer, but not ongoing past this.
Right. And so
Right.
they see that this is the last single transaction. So they're freaking out a little bit.
So how do we get more emergencies? I mean, that's the real question, right? I'm sure around that boardroom and are in those discussions with the World Health Organizations, like how can we create more emergencies?
Right.
Because
Well, and
emergency
you
use
100%
gets us off the hook.
And because that's when all the things get on there, like, oh, we're not responsible if there's adverse reactions or stuff. This is emergency. It's not approved. When they say that, that means the FDA has not approved that drug. So it's
Right.
basically being tested on us. And I don't know if you saw the video where John Campbell put the Paxlovid up against the ivermectin, and the other one was much better, less side effects, and had way better advantages, but it's because there's no money in that. And yes, we can say that word on YouTube now. But
Oh, we're back to being able to say that.
Wow.
Yes.
say it. But
Okay, I didn't realize that. That's why I didn't bring that study. But yes, there are alternatives to Paxlovid that are cheaper and have been shown to be more effective, but we're not supposed to, we're supposed to be all in on Paxlovid, I guess.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.